So in polishing a denture, I'm going to start off by using pumice, which is basically wet sand. You want it to be wet for a couple of reasons. One is that the wet sand acts, or the water acts as a lubricant and a coolant so that the pumice won't burn the acrylic. Another reason is that the water acts to bind the pumice together so that the dust doesn't fill the air and make it impossible for you to use. So you want the pumice to be good and wet, in a kind of a thick mud. If it's too soft, it's going to be hard to control. We're going to use the buffs, the rag wheel buffs. We're going to use the large brushes, which are layers of bristles interspersed with layers of Muslim buff rag, and we're going to use the small bristle brushes for the finer details. Most of the polishing can be done on high speed. Make sure that you're wearing safety glasses to polish. Often I'll wear a full face mask when I'm polishing. I'm going to start off by polishing around the periphery. Go to high speed. I'm going to polish around the periphery of the denture. I want to round and smooth all of the periphery. I'm just going to go right across the periphery, almost at 90 degrees to the periphery of the denture. I do not want to pumice inside the denture here at all. Don't pumice the tissue surface. Oops. So I think I said you want to use high speed. You don't have to. You can use high or low. Different situations. If you use high speed, it's going to cut much faster to smooth, and it's also going to give you a flatter, smoother area. So back here over the tuberosity, I want that to be just nice and flat and smooth. So I'm going to do this at high speed. If you want to get somewhere that's very curved, like up here in the palate, then you might want to use low speed, because at high speed the buff is very hard. It doesn't bend much. But at low speed it's much softer and it bends much more easily, allowing you to get into the curves of the denture. My poor old pumicing mandrel here is all stripped from too many years of use. So the buffs come loose. So after doing the periphery, I'm doing the palate. This is the area that's going to take a lot of, the palate and tuberosity are going to take a lot of attention, because I want them to be as perfectly smooth as they can possibly be. Going to go along the linguals of the teeth. Notice that I'm trying not to touch the teeth. I don't want to pumice the lingual surface of the teeth too much, because I'll flatten them right off. Pretty easy to do. You'll notice that I'm also keeping an eye on the linguals of the anterior teeth, because while you're polishing back here, it's very easy to hit this part with the other side of the buff. It's not uncommon for students to be polishing like this, watching here, while the teeth are being polished away by the other side of the buff. You want to be constantly moving the denture. Don't hold it in place. Keep an eye on what it is you're actually pumicing, but just always be moving. What you'll see is that by using this at high speed, I'm able to polish all the way around here, but I can't get up in the vault there at all. So I can switch to lower speed, and at lower speed, the buff now bends more than it did. And that's going to allow me to get much closer into the vault. So there's a much smaller area there that I can't get at. You want to constantly be turning the denture, polish it from all directions. I'm going to go back to high speed. And now with the buff hard, because it's spinning at high speed, I'm going to use just the corners of the buff to go over the labial surface of my denture. What I want to do is just smooth together, or just take the tops off any sharp bits that I made while trimming or texturing. The texture right now is fairly rough, and by going over it very lightly at high speed, I'm just smoothing it together. Now we'll do the lower. Lower is going to be very similar. First I'm going to do the periphery at high speed, and I'm going to go at 90 degrees to the periphery of the denture. So that I just round all of the periphery of this denture. You don't want anything sharp along the periphery that's going to cause an injury to the patient. So you just want to round all that nicely. And now again, I can start at the posterior. This area in the retromolar is just going to be flat and smooth. There's no anatomy there really. So you do that at high speed and just smooth it together. The lingual of the lower denture also is going to be flat and smooth. Some people will take their lower denture here and they want to hollow out the lingual area of this lower denture under the idea that it gives more room to the tongue. There's some schools of thought which say that by doing that, the patient's tongue will sit in that hollow, which will tend to capture the tongue, and then the tongue is more likely to dislodge the denture. So the preferred way to finish the lingual of the denture here is to make it just straight, flat, and smooth. It also makes it much, much easier to polish that lingual aspect of the denture.